Lansoprazole is a medication that controls gastric acid secretion. It is classified as a proton pump inhibitor. It can be given to you to control excess gastric acid secretion in your stomach. Lansoprazole may be given to you to treat duodenal ulcers. You may have dull or burning pain in the upper abdomen due to excess gastric acid release. This pain is located in between the breastbone and belly button. Often you may observe this pain around the time of meal intake. These symptoms may be more pronounced at night and disturb your sleep. You may have a feeling of fullness in your stomach, even after the intake of a small amount of food. It can increase indigestion and even reduce your food intake. You may have burping and a feeling of nausea and vomiting. Due to the decrease in your appetite, you may notice a loss in your body weight. In serious conditions, it may also lead to black-colored stools or stools with blood. Lansoprazole can also be given to you to treat gastric ulcers that produce sores in the stomach lining. Gastric ulcers can produce the breaking of protective lining in the stomach. This results in the increased attack of stomach acid, causing damage to the underlying tissues. This may result in abdominal pain, burning, and a feeling of nausea and vomiting. Many factors, including stress, chronic smoking, or use of painkillers, may induce gastric ulcers. Another clinical indication is to treat heartburn. Heartburn is a painful and burning sensation in your chest that is caused by the reflux of acid from the stomach to the esophagus. Lansoprazole is available as an over-the-counter product to control heartburn. It is a common condition that is associated with various lifestyle factors and dietary habits. You may have a sour taste in your mouth, and you may feel that some food is going to be stuck in your throat. In most of the cases, heartburn is initiated by the intake of fatty, spicy, or acidic foods. It can take up to 14 days to control symptoms of heartburn. You can observe a relief in the symptoms after 1 or 2 days of the treatment. However, it may take at least 14 days to show its full beneficial effects. This medication is not producing immediate relief of the heartburn, and it should not be used as often as needed. Inappropriate use of this medication may produce significant side effects in your body. You may also be given lansoprazole for treating the symptoms of GERD, gastroesophageal reflux disease. This condition involves the reflux of stomach contents into the esophagus. With that, you may have symptoms like regurgitation and heartburn. You may feel sour liquid coming back into your mouth. You may also have difficulty swallowing. Pain in the chest, coughing, and wheezing can also be observed. Lansoprazole can be given to you to help in relieving the symptoms of GERD. It reduces excess gastric acid secretion, therefore relieving symptoms like heartburn and chest pain. Before using lansoprazole, you should know key facts about this medication, like how it works in reducing acid secretion. How to take this medication. What happens if acid is reduced? What is its effect on your bones and absorption of vitamins? All such things we will discuss in this video. How to take this medication. Lansoprazole is available as oral disintegrating tablets at 2 strengths, such as 15 mg and 30 mg. It is also available as delayed-release capsules. For treating heartburn, it can be used at a dose of 15 mg once a day before eating. It can be taken for 14 days. For treating duodenal ulcers, it can be given at 15 mg once daily for 4 weeks. However, for gastric ulcers or NSAID-induced gastric ulcers, lansoprazole is given at higher doses. It is started at a 30 mg dose once daily, and it can be given for up to 8 weeks. A few hypersecretory conditions, like Zollinger-Ellison syndrome, still need higher doses of lansoprazole. It can be given at 60 mg per day initially. Excess gastric acid secretion can also be associated with an infection in your stomach. Helicobacter pylori is one of the pathological organisms that can increase gastric acid secretion. In such conditions, your doctor may give lansoprazole along with antibiotics. This infection produces inflammation in the stomach and induces ulcer formation. Generally, lansoprazole can be combined with antibiotics like amoxicillin and clarithromycin. 30 mg of lansoprazole can be combined with 1,000 mg of amoxicillin and 500 mg of clarithromycin. This combination should be taken twice daily for 10 to 14 days. How does it work? Lansoprazole works by reducing the gastric acid secretion in your stomach. Normally, gastric acid is released from a pump called a proton pump, which is nothing but an H plus K plus ADPase pump. It delivers the proton ions into the stomach for exchange of potassium. It also secretes chloride ions into the stomach. This produces hydrogen chloride, which is the gastric acid that is used for digestion. Lansoprazole can selectively block this pump. It acts as an irreversible blocker of this pump, thereby reducing the secretion of gastric acid for a longer time. This results in the suppression of both basal and stimulated acid secretion. Now let's see the precautions of this medication. Clostridium difficile-associated diarrhea is commonly associated with the use of antibiotics or proton pump inhibitors like lansoprazole. As lansoprazole can reduce acid secretion, it produces a disturbance in the balance of gut bacteria. This may result in the increased development of infections like Clostridium. Therefore, long-term use of lansoprazole may lead to the development of diarrhea. Lansoprazole is metabolized in the liver. In people with liver disease, this metabolism may be impaired. This results in higher levels of this medication in the body. Therefore, in severe liver impairment, the dose of lansoprazole should be reduced to 15 milligrams per day. Long-term use of this medication can also affect calcium levels in your body. This may affect your bones, leading to osteoporosis-like effects. When this medication is used for more than 1 year, it can reduce your bone density. This may be more frequent with the use of high-dose therapy. Lansoprazole may cause an acute inflammation of your kidneys. Therefore, you may have few symptoms like rash, swelling, and fever. You may have weakness and nausea. If you develop a skin rash or joint pain, you may stop using this medication and consult with your doctor. However, the skin rash may also develop due to other reasons, like an allergic reaction to lansoprazole. Lansoprazole can reduce the magnesium levels in your body. This can happen when you've been using it for over 1 year. This condition is called hypomagnesemia. Lansoprazole can interact with an antiplatelet agent, clopidogrel. Clopidogrel is a prodrug that needs bioactivation. Lansoprazole can interfere with the metabolic activation of clopidogrel in the body. This results in the decreased efficacy of clopidogrel. Lansoprazole may impair the absorption of vitamin B12. This may happen when you're using lansoprazole for longer periods greater than 3 years, or with using frequently. With vitamin B12 deficiency, you may observe a tingling sensation or numbness in your hands or feet. You may also have a sore on your tongue. Side effects of lansoprazole. Headache and dizziness are the 2 common side effects. Headaches may slowly disappear after 1 week of treatment. However, if you have a significant headache, try to avoid drinking alcohol. Replace alcohol with plenty of fluids. Diarrhea is another common side effect produced by this medication. Try to drink plenty of water, with small and frequent sips. This may reduce the dehydration. Another common side effect is flatulence. Try to avoid foods that increase flatulence. Try to eat smaller meals and more frequently. Other side effects like constipation, abdominal pain, and nausea can also be observed. That's all, guys. This is all about the important information you should know about this medication, lansoprazole. Thanks for watching this video. Share your experience and how it works for you in the comment section below. Have a great day.